We are a responsible government, Mr. Speaker. We put people first, and providing financial resources to our public hospitals is our priority. Therefore, revenues from the 2.5% levy for health and security will assist us. Mr. Speaker, let me give you an idea of what we face. 2 hospitals struggling for years to meet operational costs and starved of capital investment for innovation and modernization. What do we do as a government? Continue to fight and battle and say we don't have money? No. Let us look at what's happening at St. Jude, Mr. Hospital. Sorry, Mr. Speaker. Let's look at what's happening at St. Jude. The fire and conditions at the stadium have made the situation worse. But when Ms. Lydia Atkins, the CEO at St. Jude Hospital, and Mr. Levy, who is heading the board, look at their situation, you have to call for more resources to the St. Jude Hospital. Last year they served over 44,000 people. Before COVID-19, St. Jude Hospital served over 50,000 people. An average of 16,500 people accessing specialty clinic every year, and 33% increase in admissions between 2015 and 2019. If you look at the average cost per patient between 2019 and 2020, it jumped from $585 per patient to $719 if it's not subsidized. Now, Mr. Speaker, the cost per patient at St. Jude Hospital, it moved from $949 around 2020 to $1,173 now, unsubsidized. You have 400 staff members posting negative cash balances in 2021, 1.8 million, 1.3 million in 2022. The collection rates have gone down. Prior to COVID-19, they were collecting 53% of revenues from services. Right now, they're only collecting 23%. Critical equipment needs of $3 million. 20 nurses needed. Bed capacity over 100% at the stadium. And the cost of operation is over $33 million annually. And over the years, last year, year before, a subvention of $21 million. What are we supposed to do? What are we going to do if we want proper health care? The 2.5% levy will assist the healthcare sector, and you will see in a while what we are doing directly to assist the St. Jude Hospital. If you look at the Millennium Heights Medical Complex, Turning Point, the Mental Wellness Center, and so on, Dr. Dexter James, the CEO, and Dr. Lisa Charles, when they look at the responsibilities, and Ms. Reynolds, who's the head of the board, when they look at their responsibilities, they realize that over 50,000 people were served in 2022. Surgeries, admissions, accident and emergency, 95 people in dialysis. The cost of operation of the Millennium Heights Medical Complex, conservatively, Mr. Speaker, is at $95 million and counting. $8 million in capital costs, in capital expenses they're budgeting for this year. The current recurrent budget, last year they got $52.2 million, and $48 million of that is absorbed in salaries. And what do they collect? $5 million in services every month at the OKU, Millennium Heights Medical Complex. But they only collect $400,000 per month. So they're providing $5 million in services, but they're only collecting from user fees, people who pay the hospital and so on, only $400,000. So you could well imagine the challenge with the Owen King EU Hospital and the Millennium Heights Medical Complex. So what do you do? What do? You just stay and keep scratching your head? This government has a clear path, step by step, phase by phase, to ensure that the hospitals, the public hospitals and facilities get adequately financed. I heard the member for Miku South many times talking about health insurance. Oh, how are we going to finance health care? We started some health insurance. I want him to bring to the House the evidence with documents which showed that they had completed negotiations with any health insurance company and that they had a solid health insurance plan for St. Lucia. He cannot do it. He cannot do it.
I just want to ask a quick question about the health, the National Health Insurance White Paper that was supposed to come out last October. Can you tell me who is working on that, and do you know what the progress is so far?
Any other questions?